Hello and welcome to the Foundation for a Healthy Kentucky webinar, Health for a Change, Data Sharing, Hipaa, COVID-19, Legal Issues and Opportunities. This is Rochelle Seeger. I'm very glad you've joined us today to talk details on data and Hipaa. The Foundation for a Healthy Kentucky's mission is to address the unmet health needs of Kentuckians by developing influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. The Foundation values integrity, respect, effectiveness, leadership, policy equity, and collaboration. This Health for a Change training series began in 2011, and it started to support the health advocates working across the state to improve health. We've had a huge variety of webinars and workshops, from grant writing to health data to community collaboration to smoke-free policies, and I'm thrilled to have had the opportunity to work with such fantastic people across the state who teach me a lot and inspire me to do better work in Kentucky. The Health for a Change archives of webinars are on our website, healthy-ky.org, under the Events tab. Also there you can find a list of upcoming Health for a Change events. As I mentioned, the Foundation for Healthy Kentucky values collaboration, and this is, for me, the ultimate, getting to work and learn from people across the state of Kentucky. We do have two upcoming events I wanted you to put on your calendar. The next Health for a Change webinar will be on Wednesday, May 19th. And we will be talking all things 2020 census. So we'll speak with our partnership specialist from the U.S. Census Bureau, who will give us the update on the 2020 census, on the results releases, new census products, and we'll also have the Kentucky State Data Director talk about Kentucky connections and where you can find state-level data easily here in Kentucky. That's on Wednesday, May 19th. And on Thursday, June 10th, we will be talking health coalitions and speaking with a director at Kentucky Department for Public Health on public health transformation. Please join us for those events and share with your network as you see fit. A reminder for everyone, today's webinar is being recorded, and the recording and the slides from today's presentation will be available in a day or so on the Foundation's website under the Events tab. I will email you a link when those become available. I want to let you know about another upcoming Foundation event, and that's the annual Fall Forum, the Howard L. Bose Memorial Health Policy Forum. And this year in 2020, that date has been set for September 20th and 21st. That will be held virtually. And the theme of this year's forum is Kentucky Vaccine Policy, Myths, Messengers, and Messages. So that save the date has been launched. You can find more about the Bose Health Policy Forum on our website, healthy-ky.org, under the Events tab. Another announcement I wanted to share with you this afternoon is that the Foundation has released a request for proposals for our strategic planning consultant, and that information is also on our website under the news releases. So I'd love for you to share that with your friends and colleagues who do work in strategic planning consulting. Again, my name is Rochelle Seeger. I serve as the Community Health Research Officer here at the Foundation for a Healthy Kentucky. I'm very honored to have been working on the Foundation's mission since 2013 here at the Foundation. This series is for you. I'm thrilled to get ideas and advice from our audience on what you want to hear, on projects and information that you may need or that you want to highlight about fantastic work that's happening in Kentucky. So I welcome your email. After today's webinar, later this afternoon, I will send you a link to a post-event survey. I would love for you to take 3 or 4 minutes to fill that out and give your feedback on today's webinar, and also send your ideas for additional Health for a Change webinars for the future. This topic, data sharing, Hipaa, and COVID-19, is one that's always on my mind. I'm very interested in getting more information out about health in Kentucky, and frequently we hear the topic that data cannot be released because of Hipaa. So I'm thrilled to learn more here today from Jennifer Bernstein from the Network for Public Health Law. It's an honor to talk with her today. Jennifer, welcome to the call.
Thank you so much, Rochelle. I appreciate being asked to present, and I'm very excited to share more about this topic. I want to first start by giving a little information about myself and my organization. I'm Deputy Director of the Mid-States region of the Network for Public Health Law. We're a national organization with regional offices so that we can serve all 50 states and U.S. territories to be able to provide really tailored technical assistance services. So some of the things that my organization does, as I just said, is we provide legal technical assistance, and that's generally a free service. If you have a public health law question, you can go to our website that's just down at the bottom of this slide, and you can submit a question online, or you can email me directly. I'll have my email address on the last slide, and you can always send me any questions that you might have related to Hipaa or other public health law topics. We cover pretty much the gamut of public health law. We also do trainings just like this, and we have tons of resources that we've developed on our website, a lot of COVID-19 related resources for those that are really interested in that area. And then we also have lots of opportunities to build connections with others in the field. We often have summits and a conference and lots of webinars and other types of networking events to help you meet others. And you can also join the network from our website, and that includes getting our bi-weekly newsletter that provides information about our upcoming webinars, our resources that have been released, our upcoming events, and other things like that. So I will just start with the obligatory fine print. So the information that I'm going to present is for informational purposes only. I am an attorney, but I'm not your attorney, and so this is not intended to be legal advice or to present any sort of legal opinion. So when you're making those legal decisions, please consult your own attorney. So the objective today is to equip you with some Hipaa Basics terminology and some strategies to help maximize the exchange of health information during COVID-19 and hopefully well beyond that. And there is a lot of content. I will be going through it pretty quickly to make sure that we get to everything, and I would like to be able to take some questions. But the slides and the presentation itself will be available online later in case you missed anything. So a basic outline of what we're going to be talking about is Hipaa Basics. What is it? What does it do? Who does it apply to? What does it cover? What does it require? What does it allow? Hipaa is quite a big law, and it covers a lot of different things. But it is, I think, and if you take nothing else away from this presentation, I want you to think of Hipaa as one of the most permissive data protection laws that exists. It has a lot of exceptions that allow for data sharing when there is a benefit or value to society generally. And so think of Hipaa not as a barrier, but really as rules of the road to help us share information in a responsible way rather than not being able to share. And so to start us off, I'm going to first ask a question, and we actually have a poll that you can function so you can respond. So HIPAA, or HIPPA, stands for the Health Information Privacy Protection Act. True or false? Could you launch the poll, Rochelle?
Thanks, Jennifer. I've just sent that poll to our audience, and I hope they'll take a moment to click on true or false. All right, one more moment, and I will send the results to our audience.
Okay. So 2 of you said true, and or I think, that's probably a few more. It's changing a little.
Oh, yeah, more answers are coming in. So
yes, more answers are coming in. Half and half, 50-50. Yes. Okay. So the answer to this one is actually false. The acronym here, HIPAA, is actually supposed to say HIPAA. You often see this written wrong. And HIPAA actually stands for the Health Information Portability and Accountability Act. A lot of people think of HIPAA as synonymous with privacy, but it's a lot more than privacy. And the initial reason that HIPAA was passed was really to allow health information to be used for health insurance and to allow that information to be shared easily through electronic transactions. So people who are really familiar with HIPAA will really think of it as a law related to electronic transactions primarily, but it also encompasses privacy, security, and breach notification rules. So what does HIPAA actually do? And this is in terms of the privacy rule. There are, as I said, different rules. The law is quite large, and it covers, there's a privacy rule, there's a security rule, and there's a breach notification rule. So in terms of privacy, it requires appropriate safeguards for the privacy of protected health information. You will see protected health information designated as PHI. I will probably use that term, PHI, going forward. And when you see those letters, just remember that PHI is specific to HIPAA. It's a term of art within the law that is really specific to HIPAA. Other laws will use terms such as personally identifiable information or personal information generally. So the HIPAA also sets limits and conditions on the uses and disclosures without any patient authorization, and it gives patients rights over their own health information. So those rights include the right to accessing their health information, the right to request amendments of their protected health information, the right to request confidential communications with their provider, the right to an accounting of disclosures, which means that any time somebody discloses information to another covered entity, that they need to make a record of that, and a patient can request that record to see every time their information has been shared with others. And then it also requires and gives rights to patients to receive a notice of privacy practices from their provider so that they know how they're treating their PHI. In terms of the security rule, HIPAA requires appropriate administrative, physical, and technical safeguards that helps ensure confidentiality, integrity, and security of the information. You may see the acronym EPHI, and that's really related to information that's transmitted in electronic form. As I said, HIPAA was initially passed so that it could allow for electronic transactions related to health insurance and the administration of health care. And so a lot of it relates to transmitting electronic information, though it does cover paper records as well. So what else does it do? It provides provisions regarding compliance and investigation. It imposes civil monetary penalties for violations, and it includes procedures for hearings. So I have another question for you. HIPAA applies to most healthcare providers, true or false? If you could launch the survey, Rochelle.
That survey has been sent to the participants. And I do want to remind people, as Jennifer mentioned, that we will have some time for Q&A. So if you're logged into the web platform, there is a Q&A function on there where you can chat in questions to the presenters, and we'll have those ready for Jennifer during the question and answer time. So we'll take one more moment. It looks like about just over 71% said true and 29% said false.
Okay. Well, you guys, you guys know HIPAA then, because the answer is indeed true. So HIPAA applies to healthcare providers, health plans, and healthcare clearinghouses. These people, these entities are called covered entities. And so you'll hear that term a lot when someone is speaking about HIPAA. There's a tool through the Office for Civil Rights, which is the enforcement agency for HIPAA, called Am I a Covered Entity tool, and it's really helpful to go through to help you better understand whether or not your organization may or may not be covered. And also, business associates of a covered entity are considered considered covered under the law, and HIPAA applies to them. So, with regards to the question that I asked, the answer is most healthcare providers do fall under HIPAA, and that's because the definition is very broad. It includes things like doctors, clinics, psychologists, dentists, nurses, pharmacies, anybody who might come in contact with health information, but in addition to that contact, they also have to transmit information in electronic form in connection with what is considered to be an HHS-adopted electronic standard transaction. And those standard transactions are really requests for payment, checking eligibility, checking for prior authorization, insurance claims, and things of that nature. And so if a healthcare provider is a cash-only business and is not billing insurance or doing any of these other electronic transactions, then those providers would not be covered under HIPAA. But that is nowadays quite rare. So health plans include health insurance companies, HMOs, company health plans, government programs that pay for health care, such as Medicare, Medicaid, and CHIP, but it does not include government grants to fund health care. So if you get Title X funding for different health programs, then those kinds of programs would not be considered a HIPAA-covered health plan, and that may or may not be covered under HIPAA depending on what organization is administering those grants. So, for example, your health department, your state health department could be administering those grants, and your state health department might have other services such as administration of Medicaid, and the health department may be what is considered fully covered. We'll talk about this a little more in a few more slides, but if your health department is fully HIPAA covered, then those grants and that administration of it would still fall under HIPAA. So it really will depend, and it's a bit more nuanced than just saying all government grants to fund health care aren't covered under HIPAA. It'll really depend on the structure of your organization. And as I mentioned, business associates are also covered by HIPAA, and a business associate is a person or organization that is not a member of the covered entity's workforce. They perform functions on behalf of the covered entity, or they provide services to the covered entity. And this is the key, where access to protected health information is involved. So if you have someone that's providing services to your organization and they don't have any access to PHI, they are not considered a business associate under HIPAA. They are not required to comply with any of the requirements under HIPAA. Some examples of services that might fall within this definition are billing services, document destruction, attorneys and accountants, computer techs, software vendors, cloud computing vendors, and the list probably goes on and on. When you are receiving services from a business associate, HIPAA requires you to enter into a written agreement that's known as a business associate agreement. And what a business associate agreement does primarily is obligates that business associate to follow the same rules that you do with regards to privacy and security and breach notification, so that if anything happens to that protected health information while it's in their custody, that they alert your organization and they follow the same procedures that HIPAA would require for protecting it or notifying it if there is a breach. So the next question I have is, not all health departments are required to comply with HIPAA, true or false? And if you could launch that survey, please. I think I gave a little bit of a hint for this one.
And that survey has been sent to our participants.
Okay. False. Yep, true. So 33% is what it's showing me said true, and 66% said false. So again, the answer here is true. Not all health departments are required to comply with HIPAA. And so this is because there is a provision within HIPAA that allows certain organizations, such as health departments, to designate as a hybrid entity. And so there are indeed three possibilities for a health department. They could be completely covered, they could be a hybrid entity, or they can be completely non-covered, meaning that they would not have to comply with HIPAA requirements. And what a hybrid entity is a single legal entity, meaning it can't be subdivided. It's really the entity, the lowest level within an organization that can sign contracts, that can be sued or sue another in court, that is responsible for taxes. So that's one way to think of a single legal entity. So it's an organization that is covered, but it has parts of its business that are both covered functions and non-covered functions. And in terms of public health, traditional public health functions such as public health investigation and surveillance and responding to disease outbreaks, those activities are generally considered non-covered functions, and HIPAA recognizes that. And so what a public health department can do, or a public health agency can do, is they can designate those parts of their department that do healthcare functions, such as vaccine clinics, if they are getting reimbursed through insurance, or if you have, like a dental clinic or any kind of medical services that's being provided that is getting insurance or doing any of those HIPAA-related electronic transactions. And then you can separate out the other components that are performing non-covered functions. You'll see this hybrid entity a lot within universities as well, because often universities have medical schools or dental schools or other parts of their organization that provide medical services, but most of the university does not. And so they will they will designate as a hybrid entity in those instances as well. So there are other examples outside of health departments. So another question for you. My agency or organization is not covered by HIPAA. This means that I don't, actually, I want to go back real quick. I forgot to say, within the completely non-covered, that simply means that your health department is not providing any kind of health services or administering a health plan or anything that would be considered covered under HIPAA. And it's not engaging in any of those electronic transactions. So this is a much more rare instance, but it's not unheard of. The Minnesota, for example, the Minnesota Department of Health is a completely non-covered HIPAA entity. So they don't provide directly any healthcare services, and so they do not have to comply with HIPAA requirements in that instance. Okay. And so the question, my agency or organization is not covered by HIPAA. This means that I don't need to know what HIPAA says. If you could launch that survey, please, Rochelle. Thank you.
That survey has been sent. I think this is my favorite question of all of them so far. So folks on the webinar, please log your responses, true or false. Results are coming in. It looks great. 100% are saying false to this question, Jennifer.
Well, I'm so glad to hear that it's 100% false, because it is indeed false. There really is an importance to understanding at least the basics of HIPAA, even if your organization is not HIPAA covered. And that's primarily because you're likely to do business with organizations or have some kind of contact with organizations that are indeed HIPAA covered. So healthcare providers are a crucial source of PHI that's needed by many types of organizations and agencies to help protect and improve the public's health. Most healthcare providers are covered by HIPAA, as we said, and providers may question when you ask for information, even if it is valid and allowed under HIPAA, and they may even deny access to that information when the law allows it. And so knowing what HIPAA allows and what it doesn't, when things are mandatory and when it's discretionary per se, having that kind of knowledge will help you to counter these myths about, HIPAA doesn't let me do that. And so hopefully some of the information we're talking about today will help you better understand that. So another question is that HIPAA covers all health information. So if you could launch that survey, please.
That survey has been sent to our audience members, and I do want to remind folks we're getting in some great questions via the chat Q&A. We will have some time on the hour today to answer your questions, so please feel free to chat those into our presenter here via the chat function.
Okay, it looks like 100% false is what I am seeing, and again, people are right. That is false, and the HIPAA privacy rule covers the use and disclosure of just protected health information. And protected health information, the use of that is the sharing, application, utilization, examination, or analysis of PHI within the entity that maintains it. And disclosure means the release, transfer, provision, or access to or divulging of information in any manner outside of the organization. PHI is information, including demographic information in any form. So that includes written, electronic, and oral information. It relates to past, present, or future information, and that includes physical or mental health status, and also the provision of health care, as well as payment for health care. And so I think one of the keys is that it's information that identifies an individual or for which there is a reasonable basis to believe that it can be used to identify the information. And it has to be information that is held by a covered entity. There are lots of instances where we provide our health information to organizations that are not covered under HIPAA. So if you have an Apple Watch and your Apple Watch is, tracking all of your health metrics as you go through the day, that information being sent to Apple is not protected under HIPAA because HIPAA is not a covered entity. And there's many, many examples where this is true. And so it really hinges on whether or not the entity collecting the information is covered under HIPAA, whether it will be classified as protected health information. So it does not include student records. It does not include research records that are held by non-covered entities. Employment records that may contain health information generally would not be covered unless perhaps the employer themselves is a HIPAA-covered entity. De-identified information that has been put in an aggregate form, as long as it meets the requirements under HIPAA for de-identification, it would not be covered. And then, as I said, health information held by non-covered entities, including governmental entities, would not be covered. I have another question, and this is that aggregate data does not identify individuals. This means that I can release the information below with no HIPAA concerns. So here we have a graph that's, this is obviously fictitious data, but, we're going to assume that this is July 2020 pediatric COVID-19 cases broken down by county and age. And then we have 4 counties and we have different age brackets. Do you think that this information can be released with no HIPAA concerns, true or false? Could you launch that survey, please, Rochelle?
That has been sent to our participants.
Okay. So it looks like 75% said yes and or true, and 80% now said true, and 20% false. So the answer is actually false. And I think that this is somewhat surprising to many people when I show them this slide, because it seems that there is difficulty in taking this information and using it to identify a single person. And so the questions really here are, is aggregate data protected health information? And as you remember, we said that protected health information is information that identifies the individual or for which there is a reasonable basis to believe that an individual can be identified from the information. And this is a bit beyond the basics, but really this aggregate table has very low case counts within it. In some instances, there's just a single individual that's identified or 2 individuals. It's broken down into small age ranges in some instances, under a year old, in a specific county that has had COVID within the month of July in a single year. It actually is within the definition of HIPAA quite specific and is viewed to be problematic for that reason. If you want to get a bit beyond the basics, HIPAA does have rules regarding aggregate data and de-identification risk, and I've put the citation here, 45 CFR 164.514, and the network also has a tool that we've created called the Hipaa Expert Determination De-Identification Method, and I've provided the link here for you, so when the slides become available, you can get the link and use that to get some more information about how to go about using aggregate data, when it might be problematic to use that information for public release. Obviously, if this type of graph is being used internally at a health department and it's not being disclosed publicly, but it's being used to respond for investigation or purposes such as that, then there aren't going to be any concerns. This is really related to public disclosure of information and thinking carefully about when information could be used for re-identifying individuals. And again, if this information was held by a health department or an organization that isn't covered by HIPAA, HIPAA would not control here, and so the rules for HIPAA de-identification would not have to be followed, but at the same time, it might still be important to stop and think whether or not it was a responsible release, even if HIPAA is not controlling, or if your state law might have any restrictions on aggregate data and have rules around that as well. So the next question is, HIPAA prohibits my school district from providing to my local health department COVID-19 vaccination information about individual students absent the parent's consent. True or false? If you could launch that survey, Rochelle. So this is whether or not HIPAA prohibits school districts from providing the health department with vaccine information without parental consent. So it looks like 100% false coming in right now. Okay, so this one is indeed, I don't know why that came up as a funny character and not on the other slides, but that's supposed to be X. But yes, the answer there is false. And so it's really about what does HIPAA cover in this instance. So protected health information, as we said before, does not include education records that are covered. Those are covered by the Family Educational Rights Privacy Act, commonly referred to as FERPA. And those records under FERPA are directly related to a student. They're maintained by a school or a party acting for the school. So that can include a nurse employee or a nurse contractor. Those kind of records include transcripts, disciplinary records, and similar records. It includes immunization and other medical or health-related records as well. Even though they are health records, they're not PHI under HIPAA, but rather they're termed personally identifiable information under FERPA. And understanding when HIPAA applies or when FERPA applies can be helpful in determining when sharing of certain information might be allowed. So the HIPAA privacy rule, as we said, applies to health plans and healthcare providers that transmit electronically, and it includes protected health information. So that's information that's individually identifiable, related to patient status, condition, care, or payment. And protected health information excludes individually identifiable health information in education records that are covered by FERPA. And so really the bottom line is that if FERPA applies, then HIPAA does not, and if HIPAA applies, FERPA does not. The laws essentially do not act on information at the same time. So one or the other will control. So another thing with regards to HIPAA is what does HIPAA require? Some basics. So covered entities are prohibited from using or disclosing PHI unless it's required or allowed by the HIPAA privacy rule. And the rule provides numerous exceptions that permit disclosure. And this goes back to what I was saying before about it being very permissive. If another law provides greater privacy protection or greater rights to individuals, then they must comply with that other law. And another thing that's really key to understanding HIPAA is to remember the minimum necessary rule. So except for treatment purposes, any uses or disclosures of PHI should be limited to the amount that's necessary to accomplish the intended purpose. So don't disclose more information that's required, and do not access information that you don't need for whatever purpose you have. So permissible disclosures, the basic rule here is that covered entities are prohibited from using or disclosing PHI unless they're required or allowed to by the privacy rule. And some major exceptions are for for disclosure is patients can always have access, or their legal representatives, to their health information. And then you'll see this acronym TPO in terms of disclosures. TPO means treatment, payment, or operations. And so those are exceptions to when it can be, or information can be disclosed. So healthcare operations includes activities that are directly related to treatment and payment, supporting activities like in-house legal and support services, and administrative and managerial activities. And now I'm going to talk a bit about some exceptions that exist. So there's the friends and family exception, and that says that you can disclose PHI to family, relatives, friends that are involved in care. And if the individual is present and has the they have the opportunity then to agree or disagree with the disclosure. But a healthcare professional can infer that rather than having to ask them directly. So if someone brings their spouse with them into the exam room, a healthcare provider can infer from that action that they're okay with their spouse hearing the information that the professional is giving them. The healthcare providers can use their professional judgment. They can give individuals the ability to designate someone to receive information, and they can always revoke their designation at any time. The Office for Civil Rights has a guidance on family and friends exception that's really helpful, and so if you want more information on that, I recommend their guidance. And generally, personal representatives can exercise all of the same rights as individuals with regards to HIPAA, so access to information, amending, and so on. Another question, so HIPAA prohibits community hospital from reporting a case of COVID-19 to my health department absent the patient's authorization, true or false? So if you could launch that survey. And we are getting closer to time, and I want to make sure we have time for comments, so I probably will be going through this last few slides pretty quickly. So I'll just give it a brief moment more. So it seems like we've got it as 100% false, and that is the case. It is indeed false. And so HIPAA exceptions that allow disclosure, HIPAA includes exceptions that allow disclosure to public health departments. One of the major ones is required by law. So if there is a law that mandates disclosure, then that is HIPAA recognizes that and automatically allows that kind of disclosure. There is also a public health exception, and that says that public health authorities can receive PHI for public health purposes. That's Some of those functions include surveillance, investigations, and interventions. It is important to note that public health exception is permissive rather than mandatory. And organizations can indeed say no, but it's not an automatic way to receive information, but making sure that you build trust with those other organizations can help them, and providing them with information about the public health exception and when it applies can be helpful to get to yes for that. So one example, and I'll give this really briefly, is that sharing Medicaid information. So I've worked on a project called the Flint Registry, which is a registry that was developed to help link people that were affected by the Flint water crisis who had lead-contaminated water to services and also to track their health outcomes over time. So the registry is operated by Michigan State University, but it received a grant of Public Health Authority from the CDC, and they sought Medicaid data from the Michigan Department of Health and Human Services. And this process has been, unfortunately, years in the making. We've come into many different challenges related to how Michigan state law has been read by the Michigan Department of Health and Human Services, and though there are several potential legal pathways to receive the information, Hipaa has never been a bar to receiving that information because the registry has a grant of Public Health Authority and therefore can receive information under the public health exception. But because of certain ways that information was drafted or laws were drafted in Michigan, and a bit of a disagreement with some of the attorneys at MDHHS, that pathway really didn't work for the registry. And so we came up with a patient consent form, a Hipaa Authorization form, and then some information was actually received by becoming an authorized user through the state. An authorized user through the state of Michigan. And the final outcome is that the registry did indeed receive some of the information, but working through a lot of the misconceptions that the law was a barrier can be challenging and can take time, but ultimately I think that we can get to yes when people fully understand. Even attorneys don't always agree. So Hipaa in a public health emergency, in a preparedness and response situation, allows you to identify, locate, and notify family members. It allows disclosure to disaster relief agencies. It allows you to disclose information to avert a serious and imminent threat to health and safety of a person or to the public. It allows disclosure to protect national security. It allows disclosure to law enforcement under certain circumstances in emergencies, and it also allows disclosure for judicial or administrative proceedings with a court order. So our last question, covered entities do not have to comply with Hipaa rules and requirements during a federally declared public health emergency. True or false? If you could launch that last survey. Okay, I'm not seeing any results. Oh, there we go. We've got 100% false, and that is correct. This is indeed false. So HIPAA compliance always applies in the case of an emergency, but the Secretary of the U.S. Department of Health and Human Services has the authority to waive sanctions and penalties when the President declares an emergency and the HHS Secretary declares a public health emergency. And that's exactly what happened in March of 2020, a limited waiver of HIPAA sanctions and penalties was issued, and it is still in effect. So organizations do have to comply with HIPAA, but essentially what the limited waiver means is that the HHS secretary will use discretion in enforcement actions, and so they will take into account whether or not, disclosures were made improperly, but were made to, avert the public health disaster, to alleviate imminent danger and things such as that. And so just remembering that HIPAA always applies, but there are ways that enforcement may change during emergencies. And I'm now at the end, and I'm happy to take questions in just a second. I just wanted to point out first that our website, the Network for Public Health Law's website, has a lot of resources related to COVID-19, and a lot of them specific to data sharing and privacy. And I've worked on many of these resources, and I hope that you can go to the website and find more information that's helpful to you. And so I urge you to do that. And also, hopefully I'll have time for a few questions. And if there is anything that I didn't get to address here and you want to reach out to me for assistance, my email is here, and I'm happy to take your questions via email as well. So Rochelle, if you can help me with some questions, that'd be great.
I'm glad to. Here's a COVID-19 test question. Can you speak to when, if ever, it is permissible to share COVID test results with an employer?
Okay, great. So an individual can always share their own COVID test results with the employer if they wish. And it may be that an employer will require test results in order to return to work, and that's completely legal. And if they don't, share results, it's possible for them to institute some kind of quarantine measure, and so that is also legal. Now, with regards to others, such as covered entities disclosing the COVID results to an employer, the privacy rule permits covered entities to disclose PHI without individual authorization to persons that are at risk of contracting or spreading a disease if other law, such as state law, authorizes the covered entity to notify people to prevent or control the spread of disease. And it's very, very common. I don't know any state law that does not allow for for health departments to notify in the event of a disease outbreak. But it's important to note that the minimum necessary rule that we talked about, which requires us to limit the use or disclosure of PHI to the minimum necessary to accomplish the purpose, that applies to these disclosures. And a public health agency has discretion when determining the minimum amount of information that they need to disclose to an employee to prevent or control disease. And so generally it's advisable that if information such as location, date, and time of the potential exposure would aid in others knowing when to get tested, that could be good. Generally, information that isn't necessary to disclose, and a lot of this information is like personally identifying, so name, age, job title, generally won't be required to be disclosed in circumstances like that. And so health departments should use their discretion, and others as well, when disclosing information.
Great, thanks. Another great question that came into us via the chat here today This person asks, I have a community health coalition composed of health providers, social services, education, etc. We work collaboratively to address the full range of issues affecting individuals and families. In the course of doing what we do, we may discuss client information among our member organizations. We work only with volunteer clients. Can our clients waive HIPAA requirements for our member organization?
So this is a really great question, and in this instance, it sounds like you have organizations that are covered by HIPAA and potentially not covered by HIPAA. As you said, there's education, and so those would be covered under FERPA. And so you have essentially a varying set of rules that people are playing under in this scenario. And the best way to accomplish your goal to share patient or client information within the coalition and between all of the organizations is indeed to get what's called a Hipaa authorization. And essentially that provides the coalition with permission to share information between organizations. There is, I think, one caveat that I want to put out there. If any of the organizations are doing work in substance use disorder, then another law called 42 CFR Part 2 will apply, and it is a bit more restrictive in terms of sharing substance use disorder data and will actually require a bit more stringent of an authorization, but it's still possible to do that work with the correct authorization. It just generally what's different is a Hipaa authorization can be written more broadly to cover broad categories of patient or client information and broad, it could just name the coalition, and then organizations within the coalition would be able to receive that information. But in terms of the substance use disorder, the law requires that the individual or specific organization receiving it has to be named. And so making sure that you just understand, if there are any additional rules that might apply to some of the information that you have. And also since, you mentioned education, it might be that if education records are being shared that, within the Hipaa authorization, the person is also authorizing the sharing of their education records as well. So really understanding what laws apply to the specific data for different organizations, because as we said, Hipaa doesn't always apply, or there might be other laws that apply as well, including state laws. And so if that's something that anybody wants more information about, the network's website has a lot, or people can email me with additional support.
Jennifer, thank you so much for your presentation. A couple more questions came through, and we'll send out your brief replies via the email. I want to thank you so much for sharing all this information with us today. It really got me thinking about those papers that I get at the doctor's office, and to think more clearly and with more dedication about how in Kentucky we can persevere and share additional health information to improve health across our state. Please do check out the fantastic resources at the Network for Public Health Law's website. I downloaded a huge report from there yesterday for my evening and weekend reading. Again, this is Rochelle Seeger with the Foundation for a Healthy Kentucky. I certainly appreciate all of you for joining us here today. I learned a lot. I hope you did as well. I look forward to having you join us on the next event. This concludes today's webinar.